Next, we are going to discuss on the medicinal chemistry of doxazosin. First, we have to know the chemical structure of doxazosin, which are 2,4-diamino-6,7-dimethoxyquinazoline. It is a bioaccessory replacement of norepinephrine, so it will involve in the binding at adrenergic receptor. The methoxy will act as a hydrogen bond acceptor of serine 207 and 203 at transmembrane 5.
Next is piperazine ring, which is responsible for selectivity at alpha-1A receptor. However, in prazosin, the removal of this ring did not affect much. And finally, the benzodiazepine ring, which is responsible for lengthening the half-life of doxazosins. Furthermore, the chirality at carbon 3 of benzodiazepine affect the affinity at alpha-1 adrenergic receptor, although the difference is not much, as doxazosin exhibit higher affinity compared to R-doxazosin. This is the crystal structure of adrenergic receptor where the drug will bind. Phenylalanine at transmembrane 7 is non-selective for alpha-1. Meanwhile, phenylalanine at T6 at transmembrane 2 is responsible for alpha-1A selectivity.
The norepinephrine will bind to the alpha-1 receptor. However, when doxazosin presents, it will block the alpha-1 receptor, preventing norepinephrine to bind to it. It will bind to alpha-1 receptor, then this will inhibit the pressure effect and systolic effect of phenylephrine and norepinephrine, then this will cause vasodilation, reduce peripheral vascular resistance and reduce blood pressure.
In arterioles, doxazosin decreases total peripheral resistance (TPR), reduces afterload, hence venous return is also reduced. Meanwhile, in veins, doxazosin decreases preload. This increases venous pooling, hence decreases venous return to the heart. Since doxazosin reduces both cardiac preload and afterload, consequently, it reduces left ventricular wall stress and myocardial oxygen consumption. Reduced blood pressure is then achieved.
The main adverse effect of doxazosin is the first dose effect. The first dose effect is divided into postural hypotension, dizziness, and fainting. Doxazosin is a long-acting agent, so when the low dose of doxazosin is administered, it can minimize the first dose effect. The first dose effect occurs when the doxazosin blocks the alpha-1 receptor and vasodilation in peripheral blood vessels occur and body will have a pure ability to control the blood pressure. Therefore, systemic arterial blood pressure will fall by more than 20 mmHg upon standing. This condition called postural hypotension. The next one is when the patient changing from the supine to the standing position, the gravity tends to cause the blood to pool in the lower extremities, and the cerebral perfusion fall or syncope occur as the low blood flow to the brain. Then the dizziness and fainting occur. As we know, in the first dose effect, the blood pressure will drop as the postural hypotension occur. After that, the body will undergo the hemostasis process, which the body will increase the sympathetic tone. Therefore, the reflex tachycardia occur in order to increase the blood pressure to the normal condition. Next, the other common adverse effect of doxazosin is on musculoskeletal system, which are myalgia and back pain. Meanwhile, on the gastrointestinal system, the adverse effects are abdominal pain and nausea. The next common adverse effect of doxazosin is on respiratory system, which are dyspnea and rhinitis, and the last adverse effect of doxazosin is on sexual system, which are priapism or painful erection and sexual dysfunction.